Cats do die because of asthma attacks. There's varying degrees of severity, of course, but the worst case scenario is yes, they can be alone, they can be stressed, they can have an attack, they're unable to breathe, and they can die.
Good morning.
Morning.
How are you?
Good, thank you.
Hi.
I swear he's getting heavier.
Heavier by the day. Go on through.
Thank you, thank you.
Lisa's bringing 3-year-old Edwin to see Scott, but his weight is not the issue.
Hello, handsome boy. So, what's Edwin in to see me for today?
Well, over the last couple of months, I've noticed that he's been having terrible problems with...
Getting out of his box? Come on, mate.
Wanting to come and see you.
Yeah, it's not that bad, is it? Holding up a delight.
With runny eyes, runny nose, sneezing.
Right.
And at times having episodes of coughing where he just sounds and feels very full of fluid.
Right, okay. Well, that all sounds fairly significant, actually. It does sound a little bit like feline asthma.
Yeah. So sometimes he sounds a bit like Darth Vader. I feel really sorry for him, and there are times when he's just, seems to be struggling, seems more lethargic. He's still eating, but he's playing less. And then more recently, as I said, the coughing is quite worrying to me.
It's thought that maybe 1 in 100 cats in the UK can suffer with asthma, feline asthma. And when we're trying to manage asthma, obviously asthma can be potentially life-threatening. So what we need to do is get ahead of it, diagnose it early, and then have them on certain levels of treatment. Asthma in cats does present in a fairly similar way to people. People are short of breath, their respiration rate's high, they're just struggling to breathe, struggling to survive. And exactly the same thing can happen in cats. If we do find that it is asthma, then it can be caused by so many different things. So we do need to sort of mine down into those, find out exactly what causes might be present, and then how best to manage it. But first, of course, we need to effectively diagnose.
Sure. OK, that sounds like a good plan. Thank you.
And just remind me, because I don't want to embarrass myself, I know that you're a doctor. What kind of doctor are you exactly?
I'm an ear, nose and throat surgeon.
Yes, yeah, of course you are. Yeah, that's not intimidating at all, is it? No. Right, I really have to look after you now, Edwin, don't I?
You do. I feel a little bit sorry for Scott. It's not going to be easy because obviously I'm coming from a specialist background, but I know he'll do the right thing, and Scott's an excellent vet, so I'm very happy to leave Edwin in his capable hands.
And one thing I must say is that I have always had a soft spot for animals with human names. I've got the dogs Betty and Dave, and actually the first cat that I ever treated in the UK was called Colin, which I loved. Yes. So Edwin is right up my street.
To us, he's perfect.
Well, he certainly is.
I've never known a cat to be quite so soft as Edwin is. He never scratches. He wants to be with you the whole time. He talks to you and loves to lie on our pillows at night when we're sleeping. Bye-bye, Edwin. You be a good boy today, and I'll see you later. Now hand you to Scott. There we go.
There we go. Right. Come on, handsome boy. No pressure.
Be good, both of you.
Right, we'll try. We'll try. Say bye, Mummy.
Bye, Edwin.
I'm going to sneeze in a minute. Oh, God. Edwin, I got a little confession to make, is that I'm slightly allergic to long-haired cats, so I'm getting relatively similar clinical signs to you right now.
3-year-old Edwin is coughing and struggling for breath. But Scott's concerned the cat's runny nose could be something serious.
Cats do die because of asthma attacks. There's varying degrees of severity, of course, but the worst case scenario is yes, they can be alone, they can be stressed, they can have an attack, they're unable to breathe, and they can die. He must behave so well, this cat.
Such a good boy.
Yeah. Certainly the rag doll coming through in his easygoing nature.
Yes, very much so. If they could all be like this, our job would be a lot easier.
So today, it's about trying to diagnose the condition and see how far down the line towards asthma Edwin really is. So first of all, we're going to do some blood work. We're going to be doing some x-rays as well, having a look at the chest and seeing if there's any changes.
All right, buddy. Oxygen on.
X-ray. So the news is that it does look like the early stages of asthma. All the tubes leading down to the airways are just a little bit thickened. It shows they're a little bit inflamed, but I do think looking at this X-ray, there's definitely lots we can do to help manage this condition.
But suddenly, what was a routine investigation has turned into an emergency.
He's just not breathing the best at the minute.
Edwin has crashed on the table.
Okay, so you just have to start giving some positive air pressure.
Yep.
Yeah, we have to inflate the chest to just get a better clarity to that lung picture. But by doing that, he just stopped breathing for a little bit. When you have an animal that tries to die on you, you go into autopilot. Have we got the drops that go under the tongue somewhere? And all that training that we've done just kicks in, and straight away we start giving him some injections to try and stimulate his breathing. And at the same time, giving him positive air pressure, just putting some air back into those lungs, getting him going again. That was him.
Yeah, it was him.
Is that, it wasn't you, was it?
That wasn't me.
No, it was him.
There we go, good boy. Oh, dear, okay. So that's a nice breath there. So, yeah, he just decided to... Did someone just switch the lights off? Can you switch it back on, please?
But just as the tension starts to subside,
You're kidding.
there's another unexpected setback.
I think the power's gone.
Power's gone. Automatically, there are swear words going through my head, but you've just got to get on with the job. You have to try and not panic. It's tough.
Just keep your wits about you and focus on the cat. Keep the ISO off. Did someone just switch the lights off? Can you switch it back on, please? Just keep your wits about you and focus on the cat. Keep the ISO off.
At the Richmond practice, Edwin the cat has just been revived after crashing on the X-ray table. But now a power blackout has plunged the treatment room into darkness. Scott is trying to keep everyone calm.
Finally, we get Edwin breathing again, and then just out of the blue, the power goes and we have absolutely no light. The only light I've got to look at Edwin with, the emergency lighting. Insane. We've checked the power box and everything is up. Whole street's off.
The whole street. You're kidding.
Okay. The one bit of monitoring equipment we've got is on battery. Thank goodness. Okay. Well, we're not going to be able to do anything more until we have light.
No.
Yep.
For second-year vet nurse Jess, this is a confronting lesson.
It's just a panic, really. For my first time experiencing something like that, it's a bit of a shock. They train you how to deal with these situations, but you're never really properly prepared for it.
Oh.
Hey. Hey. Let there be light. And a breathing patient.
More importantly, so.
Yes. Good boy. Right, now we can see you again. Let's do the next step.
To try to find out more about the state of Edwin's lungs, Scott now wants to carry out another procedure.
Just as we go to perform the bronchoalveolar lavage, which is putting a tube and then fluid down into his lungs, Edwin decides to stop breathing again. There's too much at stake here. He's far too compromised, and there's absolutely no way, when a cat isn't breathing, am I going to put fluid down his lungs. We're going to wake this cat up because he's just not stable. We're just not in a position to go any further at the moment. And doing another procedure which could further compromise his breathing is just not a good idea. Not a good idea for him, certainly not a good idea for us. All right, it's okay, it's all right, I know. Gave us a fright there, didn't you? We know how much Lisa loves this cat. He's certainly not going to die on my watch, I'll tell you that. But yeah, it's hairs on the back of the neck stuff. Right, so a very complicated case just got more complicated, okay? Yeah. So you guys need to watch this cat like a hawk, okay? No one leaves the side of Edwin this afternoon. If you need a toilet break, tag in your mate. I was very proud of Emma and Jess. Jess, it's the first time she's seen anything like that. And rather than cry or shake or be in the corner, she was actively participating in resuscitating Edwin and bringing him back to life. She's a good one, that one. Watch this space. This is what we all trained for, and you both did excellent, really, really well. So good job, good hustle.
Any situation like this, the few hours afterwards are always the crucial ones. He's still not fully recovered. Yeah, this is us set in for the afternoon now. When you've got a critical patient, you don't need bedside. Hi, buddy. How are we doing? A little bit better than this morning. You ready to go home? I need to take you out of your litter tray, though, because you're not helping me being stuck in there.
As for Edwin, it's been 5 hours since his near-death experience.
Hello, buddy.
Here he is.
Here's a handsome guy. Look, who's that? It's his mummy.
Scott's not looking forward to breaking that news to Edwin's owner, Lisa, who just happens to be an ear, nose and throat surgeon.
So, yeah, eventful day. He gave me a bit of a shock today because we went through the process, took the blood's beautiful. We then went to X-ray, and just after that, he stopped breathing. And then he decided to not breathe for quite a considerable amount of time. So he had to do external air resuscitation, just basically filling his lung.
Oh, well, with my animals, I have to say nothing surprises me, but, you know, obviously Scott and his team are, you know, consummate professionals.
Lisa's taken it well, but Scott's decided not to give too much information.
Although I'm always completely honest with clients, sometimes there's maybe a little bit too much honesty, and I wonder if we say that we were watching the cat recover in darkness because all the power had gone out, might have been a step too far, so I think I might tell her that tomorrow. I think you and I thought maybe it was at the milder end of asthma. Yeah. The way he's responded to just basic breathing under anaesthetic makes me think that it's much more severe than we first anticipated. So I'm going to be recommending to Lisa that we start with a puffer spray, an inhaler. Just something to be able to provide Edwin with a medication which will cool down the allergic reaction, cool down the inflammation, and get him breathing a little bit easier. What do you think of that? Too bad? Indifferent.
Yes.
Oh, that's okay.
It's not overly impressed.
We will see an improvement,
Sure.
which will mean that we shouldn't get caught out by an asthma attack in the future. So although a scare for me today,
Yeah.
I think the long term is actually pretty bright for him.
Can you hear that, Edwin? Oh, thank you very much. Thank you.
I think he's in good hands.
Oh. We've got a diagnosis, we've got a plan, and you know, we'll carry on from there. Yeah.
All right, well, mate, your time is done, and I'm really glad that I've been able to send you home in one piece after the scare.
Well, thank you so much.
Today.
I'm sorry he caused you so much trauma.
Oh, no worries, mate.
I'm sorry.
I really hope that he's going to get in this box a
Yeah.
little bit easier than he got out.
In you go, good boy.
Boy.
Good boy. Right, let's get you home and get you some supper.
Take care.
Okay,
Bye-bye.
all right, take care, bye-bye.
Hi, I'm Dr. Danny. If you enjoyed this video, then please remember to subscribe to the Bondi Vet YouTube channel. Click on the screen now to continue watching more great content.